Hi everyone, this is Lindsay Bailey,
And I'm Alex Carrico.
and you're listening to UNC Trauma Talks.
Hey everybody, thank you for tuning in to UNC Trauma Talks. I am Alex Carrico, the nurse educator and outreach coordinator for the UNC Trauma Program. Today we have a very special podcast. It's very dear to me as this is a project that Lindsay and I have been, brainstorming and talking about for, well over a year now. We were able to catch up with Meredith down at New Hanover Regional Medical Center and Olivia at Wake Baptist. And these are two individuals that are involved in the Trauma Survivors Network within their respective areas and regions. And we're proud because we are now able to use those connections and gain access to real trauma survivors. And this is exciting, guys, because it's been very well documented that stories resonate with others, right? Everyone can relate to a story. It's one thing if I tell my 13-year-old daughter, wear your helmet when you're riding a bike. Chances are she's going to think I'm just being a dad and I'm just being nerdy. However, if she listens to another 13-year-old that was not wearing a helmet while riding a bike and had a traumatic injury and had this long road of recovery, I think that tells a different story. It allows her to take a walk in her shoes for just a little bit and really educate and prevent further injury from occurring. So, without further ado, I want to get into the podcast. But again, please stay tuned and subscribe to us, like our channel, because in the coming days, weeks, etc., we're going to be interviewing some awesome trauma survivors, hearing about their story, hearing about the recovery they had and the changes they've made in their life. This is going to be very inspiring, and please just share this with anyone that you feel will benefit from this. Awesome, guys. Thank you.
All right, I am so excited. We have two Trauma Survivor Network experts on the call with Alex and I today. Ladies, would you like to go ahead and introduce yourselves and tell us about your roles at your respective hospitals?
Great. Hey, Lindsay. Thanks for having me on your podcast. My name is Meredith Bell. I work at New Hanover Regional Medical Center. We're a level 2 trauma center in Wilmington, North Carolina. And my primary role for our trauma services department is injury and violence prevention coordinator. However, I serve a dual role as the Trauma Survivors Network coordinator, or TSN coordinator, as we like to abbreviate it. My background is in nursing. I'm an RN, and I have experience in emergency department and trauma, obviously, and as well as pediatrics.
Thank you, Lindsay, again for having me join you. I'm Olivia Smith. I am the Trauma Survivors Network coordinator at Wake Forest Baptist Health in Winston-Salem, North Carolina. We are a level 1 trauma center, and I wear also a few hats as well. I am the coordinator of Trauma Survivors Network, but also I am the screening and brief intervention for alcohol and drug use coordinator for our trauma service for adult and pediatric trauma. My background, I am a licensed clinical addiction specialist as well as a licensed clinical mental health counselor.
Awesome. Well, thank you both, Meredith and Olivia, for giving those introductions and a little bit about yourself. So the next question we want to ask is, you mind just telling us a little bit about the Trauma Survivors Network program, and then really what the goal of that program is at each of your institutions?
So the goal of the TSN program at New Hanover Regional Medical Center is really to provide our trauma survivors not only with resources and support in the hospital, but also after discharge. So our service line starts preparing patients for their recovery and discharge the minute they enter the hospital, and then we continue to give them support once they get discharged, either to rehab or home, whether they're doing outpatient therapy for a year or we still connect with them years after their discharge. They get a trauma patient handbook when they come in, or their family member does if they're not able to receive it. And then we have everything in between to a monthly support group for survivors and their families once they're home.
Similarly, at Wake Forest Baptist Health, we look very similar to providing support to survivors and their families. Immediately after a traumatic event, they get support in the hospital in kind of a variety of ways, visiting with patients, offering them support, as well as we have peer survivors that visit with patients and their families while they're in the hospital. We also then do have it's called OASIS, so outreach information sharing that we provide. It's formerly with Trauma Survivors Network. It's called Snack and Chat, and it's kind of a mobile cart at our hospital that goes around to all of our floors, so our ICU floor and our regular trauma floor, and kind of provides some snacks and some beverages, coffee, that kind of thing. And we also have a counselor that kind of directs that cart to the floors, and she's able to provide support to family members that are here visiting their loved ones in the hospital. We also have a monthly support group as well that provides support to survivors and their families once they leave the hospital. That's just additional support.
That's awesome. Yeah, I think that snack and chat thing it's a good icebreaker, really, because I know often, you know, any victim of trauma, it's difficult, and it's difficult to get in there to open up and to, you know, acknowledge that, you know, maybe you do need resources. So I think that's awesome. Thank you, guys.
Yeah, definitely. She also has community resources on there as well, so she's able to provide kind of a variety. It also does, you're right, makes that first connection, especially when they're in the ICU. If we haven't been able to see the patient yet, you know, we're able to kind of reach the family and just kind of provide that connection as well, like kind of very early on.
Yeah, absolutely. Establish that rapport and trust. That's great.
Yes, definitely.
Awesome. And then, so what do you guys think really motivates your guys' volunteers to connect with these trauma patients? You know, what's the driving factor behind that?
I would say what I've seen with our survivors is that they really have a passion to offer, that kind of been there, done that experience, that perspective to the patient that otherwise they're probably not going to get. The doctor can't provide that. Nursing staff can't provide that. Their therapist can't provide that. So there's something inside trauma survivors when they have that positive outlook on their recovery. It gives them that desire to give back and provide encouragement to somebody who's maybe walking a path that they've already gone down.
Yes, I agree with Meredith. I think, too, it's the idea that they're able, that part of their recovery of being able to be at a point to give back and knowing what it was like to be in that hospital bed and knowing kind of the questions and maybe the struggles that patient, you know, or new survivor is going through at the time. So the opportunity to be able to share some sense of hope and kind of focus, like fostering on that resiliency that's in survivors. To really just offer that additional level of support.
Yeah, no, that's awesome, and I think that it really kind of speaks both ways, because it can probably be therapeutic for both the volunteers, as you mentioned, you know, depending on what stage of healing they're still in, right? So it's definitely kind of a two-way street there. Awesome. Thank you, guys.
Yeah, I think, well, so I know for us here at Wake Forest Baptist Health, our survivors have to be a year out to be able to volunteer. But you're right, that recovery is still happening. You know, I think we talk about that a lot in support group too, is just that sense of giving back. And I had several all at once, it felt like, that were at that point in their recovery where they wanted to give back. They were a year or more out from their injury, but they were where they were just kind of coming to support group and different, you know, interactions with Trauma Survivors Network. They just kind of were like, this feels like something I really want to do. And so, yeah, I think there's a strong pull there to just offer that additional support.
That's awesome. And then really that's how it moves the program forward, right? I mean, unfortunately,
yes,
but you do need a kind of a revolving door of individuals. So that's great. Mm-hmm. Great to hear.
On like the flip end, you know, we've talking about how they connect with the trauma patients. What are some of the, you know, benefits that you have seen come out of this program for the trauma victims themselves and also for the volunteers? And how have you seen the trauma patients react when they connect with the Trauma Survivor Network volunteers?
I think, like Olivia was saying, it gives them so much hope. Really hope, positivity, that resiliency. That's what's going to make a difference in a trauma survivor's recovery, whether it's very challenging or just a little bit challenging. This is kind of an intervention, we'll call it, that hospital staff just can't provide. And so I think, like we were saying, it's very good for the patient to experience that, and it's also good for the peer visitors to experience that too, and be able to contribute.
Yeah, I've had similar experiences with as well as a benefit for everybody. I know that I've had a couple of times where physical therapists will give me kind of a referral for maybe a peer survivor to visit, with a new survivor in the hospital, and then tell me later, oh, they did great with therapy, thanks for so-and-so, seeing them and offering them that encouragement. I think also, I know specifically for injury specifics, like spinal cord injuries and amputations, there's lots of questions, that are that specific that sometimes doctors, like Meredith said, can't answer and can't give that standpoint. So we, they're able to give that kind of note, hey, this is what I experienced, and also then maybe even answer more personal questions like that new survivors may have. I also do think, on that, the benefit of TSN2 just for peer volunteers is that support group aspect. I have a lot of them that come to support group, and, that's kind of where they grew that bond with other survivors and family members who want to give back, that encouragement from others to, hey, listen, like you're at this point, like maybe you're ready to give back, or, just having that sense of kind of a community. I know some of them refer to it as our support group as a sense of family, or even, I have one guy that calls it's a club I didn't ask to join. And so just kind of offering that sense of support right after something like that happens really benefits, the new survivor as well as the, survivor that's giving back.
Yeah, I would agree about the personal piece, because there are a lot of instances where a peer visitor goes in to talk to a trauma patient, and they're just so thankful to get to ask somebody, well, how do you do this now that you're in a wheelchair, or now that you have an amputation, that they don't feel like they could ask anyone else that, or maybe they're not comfortable asking anybody else that question just yet.
Definitely.
Yeah, I think that kind of puts it into perspective of how real it is, right? You can't you guys mentioned earlier, both of you, I think you can't, ask the doctor for his or her opinion. You can't ask the nurse for his or her opinion, because they're not living that same life. They're not taking the same walk as you are. So I agree. I think that, numbers only speak to so many people, but stories really, everyone can relate to them, because everyone has a daughter, a son. Everyone can put themselves, in that individual's kind of shoes for a minute and feel that emotion there. So,
absolutely.
And I piggyback on what Meredith said. I don't have much to add. I think everybody chooses, depending on what their injury is, how do they, then advocate for, what they either want for themselves or, their family going forward. So I think that it's very valuable to have kind of a story that has much a personal connection.
Thanks for listening. For more information, you can go to our website at tarhealtrauma.org or visit us on Facebook at UNC Tar Heel Trauma.
thank you all for listening, and remember, stay safe.